One of the most common things that people come into our office for is pressure right there at the back of the head. They feel that heavy, full feeling at the back of the head. They always feel like their head is a pumpkin on a stick. Oftentimes, they feel shooting pain radiating up the back of the head and just a general overall discomfort that just doesn't go away. Massage helps for a day. They take painkillers, it helps for a few hours. They go to physical therapy, it helps for a little bit, but that constant nagging fullness of the back of the head just doesn't go away. Well, why is this happening? Those muscles right there are called the suboccipital muscles. They attach to the back part of the skull. They attach into the back part of the first cervical vertebra called the atlas, and they also connect to the bony projection off the second cervical vertebra called the spinous process. When those muscles are chronically tight, it causes that fullness and the heaviness and the headache and the pumpkin on the stick feeling because those muscles just won't let go. So the question is, what's causing it? Why won't those muscles let go? The head weighs 10 to 12 pounds, and the top vertebra it sits on weighs 2 ounces. So when there's a blunt trauma, whether that's a car accident, a slip and fall, a sports injury, it can cause the top vertebra to shift. Now, the head, the C1 and C2 are largely held together by a group of ligaments, and the ligaments, when they get injured, they don't heal as strong as they used to be. And when the joint loses stability, the muscles lock down. And so the way to fix it is you got to get to an upper cervical chiropractor who takes 3D imaging to ascertain exactly what direction the segment's off, how the joint has misaligned, and then a very precise force is delivered into the segment to get it back in its normal range of motion. And those muscles will start to unwind, and the heavy feeling will start to go away. And the head that always feels heavy and cemented onto the neck will relieve. And if you have shooting pain up the neck, which is coming from a nerve called the lesser and greater occipital nerve being entrapped, when that muscle starts to let go, the occipital neuralgia type symptoms start to go away. So if you're someone dealing with these types of problems and you've done all the things I mentioned, the PT, the medication, the massage, and you're still left with this chronic pressure that just is driving you nuts, leave a comment in the comment section below and we'll find you a doctor in your locale.